Have you ever thought that ADHD, attention deficit hyperactivity disorder, can be diagnosed in an 80-year-old patient? Hello, my name is Dr. Elena Mucci. I am consultant geriatrician and dementia specialist. And recently I saw an 80-year-old lady, Mary, in my clinic who presented with dementia diagnosis for a second opinion. It wasn't until I spoke to her daughter that ADHD crossed my mind. Hear her story. Mary is 80 years old, and over the last couple of years her family noticed that she is increasingly unable to deal with her finances, banking, pay her bills. She is very distractible. She is unable to be in the same place for too long. She constantly has to be doing something, going somewhere. She can't even hold a conversation with her friends for too long before she loses attention and has to go elsewhere. It appears that her symptoms deteriorated ever since her husband moved out and they separated. The family was very suspicious that mom might be having a dementia, and they were seen in memory clinic. However, her neuropsychological tests and memory tests, as well as all memory blood tests and MRI brain scan, were all within normal range with some mild cognitive decline in several domains, and the conclusion was that she might be suffering from age-related cognitive decline. At most, she might be having mild cognitive impairment, which is a state distinguishing age-related decline and dementia. It's sitting somewhere in the middle. The penny dropped when her daughter told me that she was recently diagnosed with ADHD herself, and I thought, could my patient have ADHD as well? ADHD is not just a diagnosis we see in children and younger adults. We know that the prevalence of ADHD in older adults is about 3%, whereas in younger adults, in children, it's about 4.5%. It all makes sense if you think about this logically. ADHD wasn't a diagnosis when our older adults, my patients in their 70s, 80s, were children. So it is possible that our older patients who would have been diagnosed with ADHD as a children, compensated, went through their life with these symptoms, but did not get the diagnosis, and they were compensating for their symptoms whole their life. Let's have a look at the classical symptoms of ADHD. These are problems with attention or inattention, problems with impulsivity, and problems with activity levels, hyperactivity. The signs of inattention you might observe in your older relatives are distractibility, difficulty in completing tasks, difficulty listening, managing money, managing their finances, procrastination, problems with mood disorders such as depressive disorder, anxiety disorder, and of course they might present to dementia clinics and might get a diagnosis of dementia. The diagnosis of dementia gets questioned when 5 or 10 years later there is very little deterioration in symptoms, or one of the family members gets diagnosed with ADHD. ADHD is one of the most heritable conditions in medicine, and often the diagnosis of ADHD in a child or grandchild makes the family members suspect whether the symptoms which they see in their older loved ones might be due to this diagnosis as well. Of course, ADHD can either coexist with many other diagnoses such as depression, anxiety, bipolar disorder, or even dementia. The point I was trying to make it today is that it really has to be suspected in older adults with near normal neuropsychological tests or memory tests with a family member having a diagnosis of ADHD. Of course, there is a very strict diagnostic criteria for the diagnosis of ADHD in older adults, and if you suspect that your older relative might have this diagnosis, you should seek a second opinion from a psychiatrist. So what help can be offered if we make a diagnosis of ADHD in an older patient? Well, there is a psychoeducation, medications, support groups, and cognitive behavioral therapy. I will start with psychoeducation. A lot of older adults might not even heard of a diagnosis of ADHD. So all the problems they had been experiencing during their lifetime, they might be blaming themselves. As you know, ADHD is associated with relationship problems, and our older adults with this condition are likely to be divorced and to be experiencing all the problems with loneliness. So explaining to them the diagnosis, explaining the signs and symptoms of ADHD and all the problems they might have experienced throughout their lifetime, it just might make sense to them and help to accept and understand that it wasn't their fault what was happening, but it was this condition. In terms of medications, this is more complex, and the medications which are used for treatment of ADHD in younger adults can also be used in older adults, but of course the side effect profile is not that preferable and the complications would be huge. Therefore, the medication treatment would be limited to few older adults and should be done under very, very strict monitoring. In terms of support groups and cognitive behavioral therapy, that is a must, and finding fellow older adults with the same diagnosis and actually talking to each other will be of great help. I made this video for all the people out there who might have signs and symptoms of ADHD but not quite understanding what is going on with them. I also made the video for children and grandchildren of older adults who might have diagnosis of ADHD themselves and might have noticed some problems with their grandparents which they will not be able to explain and thought that their loved ones might be having dementia. This video is also for dementia specialists out there who should consider diagnosis of ADHD in some of the patients presenting to their dementia clinics. Thank you.